Hi everyone, it's Dr. Brooks. I wanted to talk about my biggest pet peeve. So my biggest pet peeve when I see the kids that have been diagnosed with autism is the lack of referrals that the families are given and the lack of education and options they're given. So they are diagnosed, of course, in that report, they are told about ABA. If they got diagnosed by a diagnostician that can give prescription medications, they're often given that as an option as well. That usually is a psychiatric medication of sorts. I really wish that we would start seeing parents being given all their options. Now, that doesn't mean all your options are good for you, right? But without knowing your options, how do you know what you want to do? So I wish that would look at the medical portion of care from a more holistic standpoint, like functional medicine, which is what I do with the kids, as well as looking at speech therapy and occupational therapy. Those should be a starting point, right? Usually when parents come into my practice, they are feeling horrible that they weren't told these things or didn't know. Well, you're not supposed to know. That's why you go for a diagnosis and you hope that they will give you direction from there. And many times they're not giving a whole lot of direction. So let's help spread the word on options for the families. Certainly if you come into my practice, I help you navigate that as to where I think your time should be spent therapeutically. I do a full milestone assessment so that we sort of know where you stand and where to go. And then I share that information with whom you are going to have your evaluations with. That way they sort of have me there without me being there, so to speak, so we can work as a team to get your child on the road to recovery. So I wish you all the best. And if you could just help me spread the word, that'd be great. Thanks so much. Bye-bye.